All right, thanks for staying with us on this special coverage as we focus on the ongoing polio vaccination campaign in the country and a much broader conversation on eradicating polio in Kenya. Just very quickly, once again, I'm with Professor Ezekiel Wafula, who is the chairperson of the National Polio Expert Committee, Dr. Marybeth Maritim, who is an infectious diseases specialist, as well as Rehab Wamboi, a polio champion based in Kiambu County. Now, Dr. Marybeth, when you talk about vaccinating children under 5 years, why is it so crucial to do that? And what are some of the potential risks of not being able to vaccinate children within that age group?
Thank you, Zainab, for that question. So polio is a vaccine-preventable disease. And what this means is that there is a vaccine that can prevent polio. And from listening to Rehab's story, if she had received the vaccine, she would have actually been prevented from contracting polio as a disease and developing the disability that she currently has. So polio exists in 3 strains. We have 3 strains of polio virus, type 1, type 2, and type 3. And the vaccine that currently exists, initially the oral polio vaccines used to contain the 3 strains, type 1, type 2, and type 3. Around 2014, there was removal of type 2 from the vaccine, and this moved from trivalent. Trivalent meaning it has the 3 types, and then now we have bivalent oral polio vaccines. In the bivalent oral polio vaccine, it contains type 1 and type 3, and it doesn't contain type 2. And this is because for a very long time, we haven't had wild type polio of type 2. What we actually have had a problem with is circulating vaccine-derived type 2 polio that Prof talked about. So when the vaccines are developed, the development of the vaccines allows them to be passaged through a mechanism which makes the virus to be able to mount an immunity within the body but not cause disease. We call that they are weakened through the process of manufacturing the vaccine. So like Prof explained earlier, when we have had the type 2, in some cases when it exists, it's able to some extent to revert back and be almost similar to the wild type 2. So in this campaign, because we are responding to the outbreak, and this outbreak has been caused by circulating vaccine-derived type 2 polio virus. So the campaign is using a new type. It's called a novel oral polio vaccine that has been developed and made in such a way that it's not able to revert back to the wild type, but is able to provide protection. So you mentioned the counties that are taking part. So because of the surveillance that identified the areas where we talked of 4 cases in Kakuma and 1 environmental case from Kamkunji. So the vaccine, because it's a response, it's targeting those areas, because when you have evidence of polio, either in circulating in people where there's feces. So we actually look for polio in feces, because polio infects through the intestines and is able to be passed and is found in the feces of someone who's infected. So from that surveillance, then you're able to respond. And that's why the counties have been selected, counties that are in close proximity to the western part of the country, as well as even Nairobi, because of the circulating virus that was identified.
So that's why they've also been identified as high-risk
counties. Yes. So when you're looking at the response to this outbreak, once you have evidence of polio, either in the environment, which is in the form of the sewage, and we know that there could be that potential of drinking that contaminated water. So it makes it that the children in that particular environment then would be vulnerable, and that's why giving the vaccines is able to protect. So as Prof mentioned, when you have polio is one of those diseases where people can be infected and they wouldn't know that they're infected. So when you have about 200 people who are infected, only a few of them will develop symptoms, and maybe 1 out of those 200 will actually develop the paralysis. So it's one of those diseases where many more people would be infected and they wouldn't know that they're infected, but they would be able to pass the virus and likely to infect others. So by vaccinating the children, 5 years and below, you're actually improving the immunity.
All right.
So one of the things that has been found is that polio is likely to circulate and cause infection in areas where the coverage is low, and there could be that they are vulnerable children who are likely to be infected. And that's why when you have campaign, then you're able to reach very many children within a given time and be able to improve the immunity within the community.
All right.
Yes.
Prof, indeed, we've seen and understood, especially from Dr. Marybeth, that this is a very targeted campaign against the strain, the outbreak that we've received reports on. But we've seen several other campaigns being initiated in the country, not even one, sometimes 2 or 3 times in a year. What does that help in terms of helping manage the spread of this virus then?
Thank you. The campaigns actually have been made in response to outbreaks. So as Dr. Marybeth has said, this has followed what you said, reported cases in Kakuma and over here. Mm-hmm. All the other campaigns have been following such outbreaks. Mm-hmm. And the reason we are doing campaigns, our surveillance, which is a method of trying to find out how the immunity is like based on vaccination, has demonstrated there are some areas in the populations where the vaccinations have major gaps. The coverage is much lower. There are many children not covered. So those are the children where if you have infection, they get infected and they keep the virus going. So the campaigns that respond. In fact, to answer you a little bit, if the immunization, which is routine immunization, mm-hmm. if it was effectively carried out so that everybody was vaccinated, then there would be no need for the campaigns. Because if all the children are vaccinated and they are immune, then they would resist. That's on one point. The other point is that it's information now available that we normally talk about 3 doses of polio. That is the first vaccination, second vaccination, and then third. Mm-hmm. The reason they are given is that the 3 strains of viruses do not all get taken up in terms of immunity at the same time. Only one takes up. But studies now over the campaigns have demonstrated that in spite of what we used to think, that 3 doses of polio vaccination provide adequate immunity, we now know, like in experience in India, up to 10 may be required mm-hmm. to be able to provide adequate immunity for a child who has received. In Kenya, maybe not as many, but we need it that way. The reason also why we have campaigns in Kenya.
And just to hold on to that point before you get to the next one,
yes.
We've normally seen it being given in 2 doses.
Yes.
So the first dose and the second dose.
Yes.
You say it is paramount to even have more doses of the same, right?
Yes, yes.
So what happens for a child who only receives 1 dose of the polio vaccine and does not get the second dose then? That is on a normal
One of the things that happens, if you talk about the campaigns, the campaigns themselves, it has been demonstrated that when you do the first campaign followed by the second one, then the level of immunity you acquire in the population you are targeting is much higher, mm-hmm. adequately higher. So if you did only one, the performance will be poorer. That's why we have the 2. Mm-hmm. Now, if a child receives only 1 dose, you remember I told you that when a child is vaccinated initially by the trivalent vaccine, mm-hmm. during a vaccination, only one of the strains takes, the others don't. That's how it operates. Sometimes when they have diarrhea, even the diarrhea, because of various viruses, the diarrhea infections by viruses interfere with the taking of the polio vaccine. Mm-hmm. So if you take if 1 dose only is given, and you remember that you need multiple doses beyond the 3 we have traditionally given, then the likelihood of this child being immune to the 3 strains is very little. Mm-hmm. So we have to give multiple doses to ensure that all the children are immune, are resistant against the 3 strains of poliovirus, because each one of them, each of the strains can paralyze independently. And the protection and the immunity to type 1 does not protect you against type 2 nor type 3. So you need to be resistant against all the 3 types of poliovirus.
So that needs a lot of